Good afternoon, everyone. This is Kim Beer. We'll get started in just a couple minutes. We'll let attendees continue to log in. Thank you so much for those who already signed in. Good afternoon. I think we can go ahead and get started. I hope my volume is okay. I think the interpreter was noting that I sounded quiet. Hopefully that's better for you. I want to welcome everyone. Good afternoon. My name is Kim Beer. I'm the Senior Director of Public Policy. It's really wonderful to have so many of you join us. I know it's been a long time. We missed you, and so we're really excited to give you an update on what's happening. And I want to welcome all of our regional champions and our new advocates and anyone who's new. And I'm sorry, just one moment. It sounds like my sound isn't great. One second. I hope that's better. If my other colleagues can let me know about my volume, so I don't want to continue if I can't be heard. Okay, great. Anyway, welcome, and I hope everyone is doing well. If you're safe and healthy, I know we're sort of living under very extreme weather circumstances, so I hope that you're all doing well. Please reach out. Please reach out if you need any help from us or our information specialist team. We're really thrilled to join you this afternoon. As a reminder, we'll have a recording. We'll do some Q&A at the end, but feel free to always fill out the bottom Q&A section, and we'll monitor that throughout the webinar. So let's get started. Wonderful. So today it's our July webinar. We can't believe we're halfway through the year. We'll have some Advocacy Day updates. I know many of you participated, and we're really thrilled to give you an update on how that day went. It's our first one we've ever done at the Reeve Foundation. Our colleagues will provide some congressional updates. We'll provide some Reeve updates and grassroots updates. And then of course, we'll take some time for Q&A at the end. As a reminder, I'd like to talk about who's on the panel today. Next slide, please. My colleagues, John Sawyer from Waxman Strategies, and my awesome coworkers, Angel Hines and Gerard Arnhem, will also join us today, which I know you communicate often with Gerard. So if you don't know Angel, please feel free to reach out to Angel also. So I want to start our webinar by really highlighting the successful Reeve Advocacy Day we held in May. And again, I know many of you participated. This was a virtual event we held where we held 66 congressional meetings with staff and policymakers on the House and Senate side, our first interaction in this capacity. And we can't wait to do it again next year. And I want to thank everybody who participated. We had really wonderful, not only participation, but pretty great impact as well. So we had 42 attendees, 20 states were represented. And of the meetings requested, we had 97% of meetings confirmed. So really, really wonderful, both a variety of House and Senate meetings. And I know we received some really great feedback. Continue to give us that feedback. If there's lots of ways we can improve the experience, please let us know. But we were really, really thrilled, and we look forward to doing this again next year as well. As a reminder, we focused on really 3 important asks that are really important to the foundation and to our advocacy mission here this year, and our priorities. The first one, of course, being maintaining funding for the Paralysis Resource Center. Our colleague John will give us an update on appropriation, so we can tell you where we are right now. We talked a lot about with members and with keen interest around the Air Carrier Access Amendments Act, and Angel will give you an update on where we are with that and the FAA reauthorization. And we also talked a lot about ensuring that Congress doesn't forget about our caregiving crisis. And so many offices have indicated that they'd be willing to host a town hall or listening session on caregiving. So we're continuing to following up on that with the offices who have indicated that to us. So right now I'm going to send it over to John Sawyer, who will give us a congressional update and remind us of some of the things that have happened since the last time we met. John?
Thanks so much, Kim, and thanks to everybody for being here. For those I haven't had the chance or pleasure to meet, my name is John Sawyer. I work for a consulting firm called Waxman Strategies, and it's our privilege to work now for several years with the Reeve Foundation and on the congressional agenda primarily. So I'm going to take us back in time a little bit. Washington can feel like it moves very fast and there's new things every day. And at the same time, sometimes it feels like it takes a really long time for things to get done. But since we haven't met in a couple of months, we wanted to start by going back to, I think, one of the big moments of the year, which was the deal struck between President Biden and House Speaker Kevin McCarthy on a bipartisan basis to outline the terms that would go along with an agreement to raise the nation's debt ceiling. So without going into all of the history of the debt ceiling, this is something that needs to happen periodically every number of years. It is oftentimes itself a controversial item, but then there are other things that each side would like to see happen as part of the deal that is forced by the need to raise the debt ceiling. And in particular, this year, the implications of that deal are playing out now as we look at the appropriations process. So I'll talk about that in a minute. But what this really all comes down to is the level of federal spending for certain programs, and those programs are a range of domestic programs as well as the Defense Department. What the budget caps and the deal that was created and agreed to does not include is things like Medicare, Medicaid, Social Security, and other so-called entitlement programs. So this deal is entirely restricted to domestic appropriations and the Defense Department. And it basically set in place caps on how much Congress could spend, one set of caps for domestic spending, one set of caps for defense spending for this current upcoming fiscal year 2024, as well as the following fiscal year 2025. So it looked at the remainder of this Congress, the remainder of the Biden presidency, and said, we're going to set in place some caps on how much funding can be spent on a range of programs. There were a couple of other important provisions that were included as part of this debt ceiling deal. Number one, part of the way that they financed the deal was to return COVID funding that had been made available to various government agencies but was not yet spent. Some of that funding will then be returned back to the Treasury. And so that's something that we're paying close attention to in terms of continued response to the COVID crisis. And then lastly, there were some changes to what are known as work requirements. In other words, program requirements for, in particular, the Supplemental Nutrition Assistance Program, also formerly known as Food Stamps Program, but a nutrition assistance program through USDA, as well as the Temporary Assistance for Needy Families Program, sort of the marquee cash assistance program for low-income families in the country. And there were changes made to what is required of participants in those programs when it comes to how often and how much they have to work in order to qualify for those programs. Importantly, there was also discussion of changes to the work requirements under the Medicaid program, but those changes were ultimately not included in the final deal. So what I want to say about this deal, and then we can go to the next slide, is again, it set a framework in place for how government spending and the appropriations process will work over the next couple of years. But like anything in Congress, that framework is just a series of guidelines, some more enforceable than others. And what we have started to see since the deal was cut is some unexpected twists and turns in the appropriations process. So we can go to the next slide and talk about sort of where we are. So just as a baseline reminder, the appropriations process is the process by which the Congress sets funding for thousands and thousands of government programs on an annual basis. And so it begins at the beginning of the year with the president's budget proposal, which is sort of the blueprint of what the administration would like to see for the next year's budget. And then Congress goes through its process of setting top line funding numbers and then dividing up all of those programs into 12 separate appropriations bills that fund all of the government agencies sort of in chunks. And the House has its process, the Senate has its process. In an ideal world, all of that process is supposed to be complete by the end of the current fiscal year, which is the end of September. And then funding is determined for all of those programs in the year ahead. It never works quite as cleanly as that, but what we can say is actually we have more information this year about where the process may be heading because of the deal that was cut on the debt ceiling and the caps that put in place. So in one sense, those caps, which just to say out loud, for domestic spending, the budget deal capped domestic spending for the next 2 years at essentially flat levels, at essentially the current year's fiscal year 23 levels, with a slight increase in the second year of the deal. It set a higher cap in percentage terms for defense spending of about a 3% increase in the first year, and then about a 1% increase over that in the second year. And so where things have gone since that deal was cut is that the House and the Senate have actually laid out very different paths. So while the deal was agreed to by bipartisan majorities in the House, Senate, and the president signed it into law, recall that all throughout this conversation, we've been using the word caps. In other words, there's a statutory provision that says you cannot spend more than this amount in the years ahead. It doesn't say that you can't spend less. And so a fight that has played out inside the House majority, the Republican majority, is that there are members in the House Republican majority who would like to see actually an even lower level of spending, especially coming out of the House. They would like to see spending returned to the total levels that were made available the year before last in fiscal year 2022. Though the House is moving ahead with appropriations bills that spend at that total level that is much, much lower than was agreed to in the deal. And they are sort of viewing that cap in the deal as a ceiling, not as a floor. What that means in practice is those cuts will not be distributed evenly coming out of the House. So in practice, the House alone is looking at passing legislation that would amount to about a 30% cut in total to health, education, and labor programs. That bill, as it comes out of the House, will only have support from the Republican majority and may not have support from the entire Republican majority. And just to say, those cuts will not apply evenly even at each program level, right? These are top line levels that are set, and then Congress and the committees will have to go in and decide how much each program will be cut, or in some cases increased. But it has to amount to about a 30% cut coming out of the House. But the House is only one part of the equation. The Senate is taking a very different approach. So first of all, the Senate Appropriations Committee leadership, Senator Patty Murray from Washington State and Senator Susan Collins from Maine, have agreed in principle that they want to move forward Senate bills on a bipartisan basis. They want to have agreement on not only the top line spending numbers, but the actual program by program levels that are agreed to in the Senate. So that goal of passing bills with bipartisan support puts the Senate in a very different place than the House. The Senate is also planning to spend basically at that cap level, at the level that was agreed to in the debt ceiling deal, also known as the budget deal, as you can see here. So I say all of that just to say that I think what we're headed for is a Senate process and a House process that produce very different funding bills, potentially as soon as this month, and we'll talk about the timing here in just a second. And then the big question is, what happens as they try to reconcile those differences? Congress is known for, when they can't reach a deal, kicking the can down the road. And in most of the past, years since Kim and I and others have been working on this, at the end of September, when the fiscal year is over, Congress typically passes what's called a continuing resolution, where they essentially put government funding on autopilot and focus the rest of the year and buy themselves some time and kick the can. So that is one potential outcome when they come back in September and have a very short window of time to finish this up. In the meantime, I think we're expecting to see additional details out of the House and possibly out of the Senate before they adjourn for August. And as a reminder, we'll talk about this in the grassroots section, Congress comes home for all of August, and that's actually a great time to set up meetings with your members of Congress and talk about these issues. So we may see details out of the House next week. And when we say details, that means program by program funding levels and any policy changes that are intended to be enacted. And it's possible the Senate will also act in July. That's their goal, but the Senate tends to move a little bit slower, and especially when they're trying to get bipartisan agreement on these bills before they're introduced. So we will be in touch with all of you as advocates as we know more. Obviously, we're focused very heavily on the Paralysis Resource Center and funding for the PRC in this process, but there are also a number of other priorities that we've heard from you that the Reeve Foundation has prioritized: spinal cord injury model systems, research that happens at the National Institutes of Health, and other key priorities that we track as part of this process. So it's a busy time because they are working out the details of these bills in House and Senate, and they're trying to get as much possible done before they leave for August. We will have more information shared with you as advocates as it comes out. And so that's sort of the funding landscape. I'm going to now turn it over to Angel to talk about the Federal Aviation Administration legislation that is also ongoing at the moment.
Thank you so much, John. Hi, everyone. I'm really excited to be able to report on FAA reauthorization. It's nice to get good news. So yay. The House bill that we have been advocating for a while now, and some of you on the call today participated in Advocacy Day, and this was one of our asks. The House Transportation and Infrastructure Committee completed its markup, and it's passed through the House, and it's expected to head to a full House vote later this week. I keep checking, it should happen anytime. And we're just very pleased that the House bill included some really meaningful provisions for the disability community. Some of these include training requirements for assisting passengers with limited mobilities, proper storage of assistive devices, improving the complaint process, and also requiring the continued study for safe and secure ways for people to stay in their own wheelchairs on board. So these are all great things. The Senate version of the bills is currently stalled right now. But I will keep everyone posted as soon as we know something, we will let you know on the Senate version. So thank you so much on that. Next slide, please. Right, so just a couple updates. We haven't met in a while, but I just wanted to bring attention to and remind everyone that this past month, June, was Gun Violence Awareness Month. June 2nd is the National Gun Violence Awareness Day. And there was a resolution in the Senate that was supported by 18 senators and 100 members of Congress, recognizing June as National Gun Violence Awareness Day and Awareness Month. And so we just want to remind people that 14% of spinal cord injuries are primarily caused by gun violence. And so we here at the National Paralysis Resource Center, our information specialists are available to provide any personalized support or resources to any victims of gun violence or their families that also need support. So next slide. It's also Disability Pride Month right now, July 23rd. You can't see, but I'm wearing my Disability Pride colors today for everyone, so I want to share that. But July marks the 33rd anniversary of the ADA, and so that is why we celebrate in the month of July. If you check out our website, and social media, there'll be posts throughout the month celebrating Disability Pride. There's also a recent blog post that on our website that details some Disability Pride events being held across the nation. So in the follow-up email, I'll send a link to that, or Gerard will be sending an email with a link to that. Right, next slide, please. I can go into some coalition updates. Oh, I get to report another win, yay. Seat elevation. Thank you so much to the advocates who worked on this. The CMS, Centers for Medicare and Medicaid Services, found that power seat elevation equipment on power wheelchairs qualifies for Medicare coverage. This is for all power wheelchairs. And coverage begins immediately. They are working right now to figure out the coding, the pricing for this. And our coalitions are meeting on this, and we will be providing updates. But the coding is expected to be worked out and finalized in early 2024. But just know that you should be able to receive this coverage, and they are working towards that soon. So this is great news. Next slide. Okay, just a little bit more on air travel. Just talked about FAA reauthorization, but I just wanted to remind you, because John mentioned August recess meetings. If any of you are going to work on getting a meeting with your representatives over August recess, you can still talk about air travel. If your representatives support it and voted for it, you can thank them. And if you're meeting with the senator, you can ask for a strong Senate bill that is focusing on training and safety standards. And we also are still fighting for private right of action to be included in that Senate bill. If anyone has any questions about this, feel free to email me and we can talk more about it in detail. And then I also wanted to share, some of you may have heard, I can't recall if this was included in one of our regional champion newsletters, but a UK-based group recently unveiled their prototype of how a power chair can remain on board. And it was very exciting. This was, they partnered with Delta over in Europe, and it shows, if you can see in the picture there, it's a locking system where it can back in and lock in, similar to what you would do on a train or a bus or a taxi. So just know that this is one of many prototypes that is currently in the process of being developed. This also was in Europe and not in the US. There's steps and things that have to take place for regulation, but it's still something to celebrate. It's wonderful to see and to hear people talking about. So I wanted to share that with you. And also, the Department of Transportation has formed an accessible air travel public awareness working group, which the Reeve Foundation is a member of, and I'm representing the foundation in this working group. And this is great because Department of Transportation really wants to get the word out to the public of your rights, to know about your rights as a person traveling, doing air travel with disabilities. So if you go to the next slide, Gerard. This is something that came out last year, a year ago this time, right around the Disability Pride month last year. And it's, we just want to remind you, and we'll send this out, but there is a Bill of Rights for air travelers with disabilities. And this is something to remember. And when you're traveling if you have issues, there's a grievance number, and please report those grievances, because that's very important for the work that we do. So we'll send this around too as a reminder. All right, a couple more things to go. We also participate in the CCD Housing Task Force, and I just quickly wanted to share a bill that Reeve has endorsed, the VITAL Act, and this is the Visible Inclusive Tax Credits for Accessible Living Act, which was introduced by Representative Evans and Fitzpatrick in the House, and forgot to add Senator Casey in the Senate. And this is a great bill that we hope there gets some movement around it, but it would increase the investment in low-income housing tax credit. One of our partner coalition members, the Kelsey, they are collecting stories from disabled people and their families to highlight housing stories. So if you have a housing story that you would like to share, we would love to hear from you. I will be sending around a form after the call for that. And my last thing is our new guide on emergency preparedness. I have a copy of it right here. It's very exciting. It just came out in May. And this resource guide is really provides so many wonderful tips on things to think about as a person or a caregiver that lives with disability during a flood, earthquake, wildfires, winter weather, tornadoes, chemical emergency. It goes over all of that. And it's available on our website. And if you would like hard copies, like the one I have here, you can request those as well, and we can send those out to you. And that is all I have. I'm going to turn it over to Gerard now.
Well, thank you, Angel. Those were amazing updates and lots going on here. But for those of you who don't know me, my name is Gerard Arnhem. I'm the Grassroots Advocacy Manager with the Reeve Foundation, and I'm just so excited to be online with everyone. Thank you to Kim, John, and Angel for just giving us those presentations, wonderful updates. But I'm just going to give everyone a quick update on the grassroots side of things. And I'm going to first start off with our inaugural regional advocacy training. Again, want to just highlight this event. This took place in Shippensburg, Pennsylvania. I was on the ground at the Coy Public Library, a local library in Shippensburg, and we were able to host this event. So at this event, myself and our colleague, Bill Cawley from the Peer and Family Support Program, we spoke and gave local community members the opportunity to learn more about the services provided by the National Paralysis Resource Center. Community members, they also gained valuable insight to the Reeve Foundation's grassroots advocacy programs, as well as how to become an online advocate for change and information regarding the Regional Champions Program, how to join. And lastly, we were able to send some resources, some free resources from the National Paralysis Resource Center to have them on display for many people, many of the residents to take. And they did take a lot of resources, which I'm so happy about. I think we had like 5 boxes, and I was able to come back to DC with 2. So that was absolutely amazing. And basically, yeah, these resources that we provided, we had paralysis resource guides, our wallet cards, bladder management, pressure injuries and skin management. The list goes on. We had so many resources available. But this regional advocacy training was designed so that the Reeve Foundation can come into these local communities, spread our resources, interact with local community advocates, and just basically let them know that you have all the power to form a relationship with your local House representative as well as your senators. And as well as if you did follow the Reeve Foundation on Instagram and Facebook, I did do a takeover, and it was a lot of fun. I showcased the event. We had all those resources. We had some interviews with people that showed up. So it was a lot of fun. So if you saw that on Facebook or Instagram, I'm happy you did. But I also just want to thank one of our regional champions that was very helpful in helping me plan this event. Her name is Jamie Clendenning. She is a Shippensburg resident. She was very big in just helping me coordinate, doing outreach, inviting people. We also had Mayor Kathy Coy, which you can actually see. She's in the background over here. Mayor Kathy Coy of Shippensburg, she attended, she gave some remarks at the start of the event. And then we also had a representative from Senator Fetterman's office come, and they took resources, listened to my presentation. So overall, it was just really a great event. I'm just so happy just that I was able to go to Shippensburg, and I am very much looking forward to doing more because, like I said, I love being on the ground with the advocates, talking with people, getting to know them. And yeah, this picture that I'm showing on the slide is just a selfie I took with some of the attendees. So I really love this selfie, but it was just truly an amazing time. Which leads me to my next slide, is I just want to do a quick advocacy spotlight of Jamie. She was a huge help in planning this regional advocacy training, and Jamie is relatively a new regional champion, but she has been no stranger to the Reeve Foundation. She's known about the Reeve Foundation for the past couple of years. Just a little bit about Jamie. She was born with spina bifida and has been living with paralysis for the past 11 years. She found the Reeve Foundation after a surgery that she became paralyzed from, and she just had no guidance whatsoever. She was sent home with no wheelchair, no ramp or anything. So she did some online searches, came across the foundation and the free information and resources that the National Paralysis Resource Center offers. And she was able to take that information, get the services that she needed. So then also she found out about the Peer and Family Support Program. She then became a peer mentor. And then back, I believe it was our last webinar in February, Jamie wanted to join the Regional Champions Program. And I've gotten to know Jamie very well. And the reason why she wanted to join the program was because she wanted to learn more about how to become a better self-advocate for herself, and just to start building relationships with her local congressional representatives and senators in Congress. But she also wants to ensure that nobody has to go down the path that she went down, where she didn't have any of the information. She was kind of just going out there into the dark, and she just wants to highlight how the Reeve Foundation provides all these resources for individuals who are living with paralysis as well as their families. I do want to mention Jamie also runs her own blog, I Can and I Will, which I love that name. It serves as a platform to foster communication, encouragement, and advocacy within the paralysis community. Jamie is a very dedicated regional champion, and I'm just so thankful that she was able to help me plan this event. Now, when she isn't advocating on behalf of herself and others, you can find her camping out in Lancaster County, Pennsylvania, with her 2 children, Matt and Sierra, and her husband, Randy, which I met all last month. And just thank you again, Jamie. And this is a selfie that we took after our event in Shippensburg. As you can see, we were very excited of how well it turned out. So our next slide is just a quick update on our online Advocates for Change. I just checked before the webinar, and we currently have nationwide 10,451 online Advocates for Change. Our end of the year goal is to reach 12,000 online advocates for change nationwide. So if you're watching right now, take out your phone if you're able to, or you could text advocate to 52886, scan the QR code, sign up to be an online advocate for change, because again, it takes less than a minute to sign up, and we would love to have you on board to be part of our nationwide community. But just as a reminder, online advocates for change, they write emails, letters, make phone calls, send messages through social media, and also take action on the foundation's action alerts, which we do have an alert out, but I will be talking about that in a few minutes. But being an online advocate, you'll become part of this nationwide community of individuals who wish to speak up on behalf of the paralysis community. And online advocacy is just a central part of the foundation's mission. And if you have any questions, my email will be in the follow-up email. My email address will be in the follow-up email, and you can absolutely ask me any questions. I love talking with everyone and just chatting away, getting to know you guys. So please email me, and also please become an online advocate for change, because it's very important to us and it's very important to everyone at the foundation. Next, I just want to talk a little bit about our regional champions program, and boy, have we grown a lot since I came to the foundation, and I'm so happy about that. But thank you all for joining, any regional champion watching or will be watching later. Thank you for joining the program. I truly enjoy chatting with each and every one of you and just getting to know you more, forming that relationship. But as of now, we have 70 regional champions across 27 states, which, wow, that is a lot. The map on the right side of the screen shows which states have regional champions in it. And just to point out a few, since we last spoke, we have a regional champion now in the state of Kansas, Montana, Arizona, and Louisiana. But one of our goals, as you can see on the last bullet point, is to have a regional champion in at least all 50 states and territories, including the District of Columbia. So we want to start, that's like a nice short-term goal we have, but long-term, again, just want to remind everyone, we want to have a regional champion in each of the 441 congressional districts. So if regional champions, if you're watching right now, if you know someone who exhibits one or both prompts on the slide, please have them contact me, forward me their information, or email me as well. We are always open to having new regional champions, and just, I just really like to get to know you. And, we can work together, meet with your representatives, senators, and then you can share your story. But I do want to highlight, by joining the Regional Champions Program, you all receive weekly newsletter updates from me, from Washington, D.C., just to give you all the 411. I try to be as comprehensive as possible, especially when there are new developments on advocacy issues we've been continuously working on over the past couple of months. But you'll also just get information about some Reeve webinars or other events that the Reeve Foundation is hosting. So again, I think this is a great program, not to be biased or anything, but please, always looking for new regional champions. And now this is the slide I was talking about a couple slides ago, which is our new action alert. So, John was giving an update on the appropriations process earlier, but we do have this action alert out now. It was published on June 29th. So I think that was like 2 or 3 weeks ago. But basically this action alert is asking our advocates to contact their members of Congress and urge them to preserve PRC funding at the current levels for fiscal year 2024. We want you to let your legislators know how important the PRC is to the paralysis community, and share your story as well. If you've used any resources from the Paralysis Resource Center, let them know your story, your personal narrative. But we want to ensure that funding is maintained at current levels of no less than $10.7 million for the next fiscal year. And I will include this action alert link in the follow-up email, or you can also text Advocate PRC to 52886, or you can scan the QR code, which will take you right to the action alert, so you can take action right now. Again, like we were all saying, PRC funding is so crucial to the foundation and to the Paralysis Resource Center. So definitely take action if you can. And then we'll go to the next slide. Now, like Angel was saying, our August recess. So that is starting on July 31st, if I'm looking at the congressional calendar correctly. Yes, July 31st to September 4th. So that's a month-long district work period, August recess. And this is a great time for our regional champions to meet with their members' offices. At these meetings, like I said, you can share your stories, experiences to the staff member or the representative, and advocate on behalf of yourself as well as others in the paralysis community. But some topics you can speak about, but are not limited to. You can talk about your air travel experiences, caregiving experiences, paralysis resource center funding. Again, you can talk really about anything. Just kind of, I will help you along the way. Hone in on your personal narrative. But those are just some ideas that if you want to meet with your member, you could think about that and just contact me and we can work something out. But I will be able to assist you in scheduling that meeting, talking with you through your personal story. So just email me if you're interested, or you respond to my follow-up email. But yeah, so definitely think about that. It's going to be a month-long district work period, so the members are going to be back in their home districts. And I really would like to help you guys. So as we near the end of this presentation, I want to highlight some of the upcoming events for anyone that is interested, such as Ask Nurse Linda webinar will be next Wednesday, July 26th. That's also the 33rd anniversary of the ADA that day. Living Well with Dr. John webinar on Tuesday, August 8th at 2 p.m. Eastern Time. And then in September, there will be the Quality of Life Grants Technical Assistance webinar, which will provide, program guidelines for both direct effect and priority impact grants, and offer technical assistance guidance on accessing the online grants portal and submitting applications. And then also a live Q&A session will be offered as well. So registration and more information on each event can be found on our website, christopherreeve.org. And I'll also link our events webpage in the follow-up email as well. So let's go to the next slide. And last but not least, we have just announced the Reeve Summit 2024. Very excited about this. I'm very much looking forward to March 2024. But it will be held right here in Washington, D.C. at the Hilton on Capitol Hill from March 6th through 8th, 2024. And some of the topics that will be discussed are like advocacy, caregiving, employment, health and wellness, and research. So more details will be released over time, but if you would like to receive updates about the summit, you can go to christopherreeve.org/Reeve Summit, or I have the QR code on the slide as well, so you can scan that and it will take you to the Reeve Summit webpage, and you can also fill out a form to receive updates from them. If you have any questions, you can contact the NPRC's outreach and education team at reevesummit@christopherreeve.org. Again, this link will also be in the follow-up email. So what time is it? Oh, we're doing good on time. So this concludes today's presentation, but we do have some time for questions. So feel free to ask away in the chat box. My colleagues and I will try to answer them, but just thank you all for joining us, and just thank you all to the regional champions for joining us. And just don't forget to email me, but I'm going to hand it back over to Kim.
Thank you so much, Gerard, Angel, and John. Special thanks to Gerard for his passion and all of his dedication to getting to know so many of the advocates. We really, we know we gave you a lot of information, but we just want to remind everyone that the foundation is here to provide resources and support. We really welcome you on our journey to advance our advocacy priorities, but ultimately we want to make sure we understand who you are, where you live, and how we can best support you. So we thank you for your time. We know life can have its ups and downs, and everyone's really busy, so we don't take that for granted. We hope to stay connected over the summer. Please know that any one of us can talk to any one of you at any time. So Gerard will send out a follow-up email with all the links, the slides, the recording, and we hope to stay in touch. Thank you again. If there's any final questions, it looks like there might be a question here. We have an advocate here who talks about their representative doesn't appear to like them very much. So we can work with you, Melody. Some people can have frustrating exchanges with their representative. And so I will let Gerard reach out to you, and maybe there's a way we can communicate with the staffer directly, if that's helpful. And maybe we'll have a different outcome as far as a response. Thank you for your message. I think that's all. I think that's all the questions. All right, great. Again, enjoy your afternoon. Enjoy the rest of Disability Pride Month, and thank you for all that you do. Take care.